Well, Melburnians, unfortunately, we're back here again. We're back in lockdown. And although there's a lot of things that we can't do during lockdown, there is one thing that can be really beneficial for our headaches and migraines. So that's what we're talking about today. What is this one thing that can be really beneficial for us? So hi, I'm Dr. Beth, osteopath here at Melbourne Headache Solutions. So particularly during lockdown, when there aren't a lot of things that we can do, so we're watching a lot of television, we're sitting around in front of our computer screens, we might be reading books and those sorts of things, we're not moving an awful lot. Okay, and when we're not moving, then this is prime territory to increase our headaches and migraines. So that's not what we want. We want our headaches and migraines to disappear. We want them to decrease as much as possible. So what is the one thing that we can focus on, particularly during lockdown, that can help to decrease our headaches and migraines? That one thing is exercise, and in particular, it's moderate cardiovascular exercise. So walking, whilst it is fantastic, and we want to get moving in any way, shape or form, walking doesn't get our heart pumping, okay? So what we want to do is we want to do a form of exercise that does get our heart pumping, so cardiovascular exercise, so that we get all of the good, happy hormones going through our body, such as endorphins, to get things like serotonin flowing through our body, so that it actually helps to decrease our pain levels. So as I said, moderate forms of cardiovascular. So if you enjoy things like jogging, then go for a jog, go for a moderate run, and these sorts of activities. If you like cycling, go for a bike ride. But when you're going for a bike ride, be mindful of your neck position. If you're crouched down in this sort of position, obviously it's more likely to irritate your neck. So if you can, be more in an upright position, so it's less likely to irritate your neck. Doing things like, if in your backyard, kicking your soccer ball with your kids, playing a bit of basketball if you've got a basketball to dribble around. Anything that, as I said, gets your heart pumping a bit. Doing some Pilates at home. Yoga in general is just good for your body, although it's not cardiovascular. It's good just for your body to get it moving and stop your joints from getting stiff and achy. But also exercise is really good for the mind as well. And a lot of us have taken a beating in regards to our mental health. So anything that can be positive towards our mental health and lifting that is really good. And exercise can be really positive to help lift that as well. So as I said, with cardiovascular exercise, it does help to decrease the frequency, or it can help to decrease the frequency of attacks of headaches and migraines. And it can help to prevent future attacks as well in sufferers. Migraine though, a lot of people don't want to be going and exercising, which is completely understandable, but when you're in the middle of a migraine, then it can be very beneficial to get things moving and, as I said, to help prevent future attacks. Really scared about doing exercise, they're really hesitant about doing exercise, or they've done exercise in the past and it's triggered off their headache. What are the sorts of things that you're looking out for when you're exercising? Help prevent exercise from setting off a headache or a migraine. A lot of the time when you've done exercise in the past and it might have set off an attack, a lot of the time it's actually placed strain so on your neck, and so your head is often in the wrong position. So a lot of people in a gym setting, I know we're not in gym settings at the moment, Melburnians in particular, if you're not in Melbourne you might be in a gym setting, then when they go to do an exercise, then say for instance they're pulling something down, they pull it down but then their head comes forward. Okay, they pull it down, then their head comes forward and their shoulders round forwards. And so this places a lot of strain in through their neck, and if you're doing this repetitively, then of course, as we know, the neck is involved in headaches and migraines, and so it's likely to set off a headache or a migraine. So essentially what you want to do is just be mindful of what your head and your neck are doing during exercise and modify it. So if you feel like there is a strain happening through your head or your neck, there is a strain happening through your head or your neck. So try to do something to modify it. So again, if you're pulling down, your head should be staying still as you're doing it. So just don't pull down as far. If you're using resistance bands at home, then again, you might want to pull down. Make sure that your head is not coming forwards. So make sure that it's in this position or slightly tucked back. If you're doing ab work and you feel like your neck is when you're on the floor, a lot of the time people will have both their head up and their feet up. This can be really challenging for the core, but it can be really challenging for the neck as well. So maybe have your head up or your feet up, not both at the same time, and this will help to take some strain out of your neck. For a lot of exercises, you don't necessarily need to stop the exercise, but you can just modify it. So as I said, have a look at what your neck is doing and see if you can take the strain out, adjusting your neck position and just being mindful of what it's doing. Is it going backwards and forwards when you're exercising, or is it staying still? Then if that's not working, adjust the weight or the resistance of the exercise that you're doing. If that doesn't change the tension in your neck, then you might need to change the exercise that you're doing. So go with things like that. If you've done running before, and that set off a headache or a migraine, because running is a fabulous exercise, a lot of people run with their heads forward, they lead with their head and they clench their jaw. Okay, we don't want that to happen. So again, make sure that your head is in line with the rest of your body. So don't lead with the head. Make sure your head is in line with the rest of the body, and make sure that your jaw is nice and loose when you're running. These things are more likely to help make exercise work for you rather than against you. So if you've got any questions or queries in regards to exercise, please drop them below. I'm more than happy to answer any questions that you've got in regards to that, because as I said, I want exercise to work for you rather than against you, because it can be fabulous. And as I said, it's been shown that moderate cardiovascular exercise can be really therapeutic in regards to helping to try to decrease pain. So give it a go. Try to get Corona fit during this time, Melburnians. Because it's a really positive thing that we can try to do during lockdown, when, as I say, there's not an awful lot that we can do, but this is one thing that is really positive that we can. We are still here during lockdown. We are classified as an essential service, which is fabulous, so we are still here to help with all of your headache and needs. So if there's anything that you need during this time, please give us a call, come in, come see us, and you can always ask us any questions or queries at any time. Hope you found this helpful, but as I said, if you've got any questions, please drop them below and I'll get back to you. Thanks guys, stay safe, and I'll catch you soon.